Alright, team, here are the symptoms we're dealing with. Behçet's disease, pylophlebitis, and tendinopathy. What are your thoughts on the diagnosis?
Could it be Behçet's disease? The symptoms seem to align with it.
I'm leaning towards pylophlebitis, considering the patient's history.
Tendinopathy is also a possibility, especially with the physical symptoms.
I think it might be a rare case of guanidinoacetate methyltransferase deficiency. The symptoms are quite specific.
Damn it, Frank. You're right. It's guanidinoacetate methyltransferase deficiency. We need to act fast. All of you, perform laminectomy on the patient.
Laminectomy? That's a risky procedure, Hawks.
Are you sure that's the right call?
It's a bold move, but if Hawks believes it's the best course of action, we have to trust him.
Let's do it. We don't have time to second guess. The patient's life is on the line.
Exactly.
Let's save this patient no matter the risk. Now move, team.
Tracy, you called me in here to discuss the laminectomy I want to perform on my patient with guanidinoacetate methyltransferase deficiency.
Yes, Hawks. I have some concerns about this procedure. Are you sure this is the right course of action?
Absolutely, Tracy. I have years of experience in this field. I know what is best for my patient.
Hawks, I respect your experience, but you have a track record of being wrong in the past. We need to approach this with caution.
How dare you question my expertise, Tracy? I know what I'm doing. Trust me on this.
I'm not trying to undermine you, Hawks. I just want to make sure we explore all options before proceeding with such a risky surgery.
Fine, Tracy. But mark my words, this laminectomy will save my patient's life.
The patient is in critical condition, Leslie. The laminectomy was not the right treatment for guanidinoacetate methyltransferase deficiency.
How do we tell Hawks about this mistake?
Let's focus on the patient first, Frank. We need to figure out the best course of action to save their life. Hawks will understand that we were doing what we thought was right at the time.
But what if he's upset about this error? We have a responsibility to be transparent about our decisions.
I know, Frank, but right now our priority is the patient. We can deal with Hawks later. Let's work together to come up with a treatment plan to address this critical situation.
What?
In the world were you thinking? You nearly killed our patient with your incompetence.
Are you even doctors?
I still stand by my diagnosis. I believe it was a herniated disc causing the pain.
No way. It was clearly a spinal stenosis issue that needed to be addressed.
Actually, I think it might have been a tumor compressing the spinal cord.
I'm with Gary on this one. A herniated disc is the most likely culprit.
You're all completely useless. I can't believe I trusted you with this case. I'm out of here before I say something I regret. Have you tried the new pasta salad? It's surprisingly good.
Yeah, I had it yesterday. Not bad. So, how's it going with that mysterious case you've been working on?
It's been a real puzzle, but I think I might have just cracked it.
That's great. What do you think it is?
I believe it's a rare form of autoimmune disorder. I need to run a few tests to confirm, but I'm pretty confident.
Wow, that's impressive. Good for you, Hawks.
Thanks, Johnson. I need to go check on something real quick. I'll catch up with you later.
Sure, no problem. Good luck with your patient.
Storms. In.
Hawks, what are you doing? You can't just barge in here without proper PP.
Yeah, you're putting everyone at risk.
This is completely unprofessional, Hawks.
We have protocols for a reason, Hawks. You need to follow them.
Ignores them. Guanidinoacetate methyltransferase deficiency was a misdiagnosis. It's actually HRM2 related disorders.
HRM2 related disorders. What's the prognosis for that?
Is it fatal or treatable?
It's mostly fatal. There's currently no effective treatment.
Oh well, we tried.
Tracy, I finally got the right diagnosis for the patient.
That's great news, Hawks. You did a fantastic job.
It's a shame this whole ordeal wouldn't have happened if I didn't have such idiotic doctors to work with.
Excuse me? What do you mean by that? You were the one who made the initial wrong diagnosis.
Well, my diagnostics team should have caught it sooner.
Hawks, you can't shift the blame like that. You declared the wrong diagnosis yourself.
Stands up abruptly. I need some air.
Size Hawks, we need to address this issue.